10 warning signs of kidney disease you should never ignore. Most people believe kidney disease announces itself with pain. It doesn't. In the vast majority of cases, the kidneys can lose a significant portion of their function silently, without a single moment of discomfort, while the rest of the body slowly adjusts to problems it shouldn't have to carry. That's what makes this organ so easy to overlook. And it's exactly why so many people don't find out something is wrong until the disease has already progressed. This video is for educational purposes only and is not intended to diagnose any condition or replace the guidance of a qualified healthcare professional. If anything here sounds familiar, the right next step is always a conversation with your doctor. Before we get into the signs, it's worth understanding just how much these two small organs are quietly doing for you. Every single day, your kidneys filter roughly 150 quarts of blood, removing waste, balancing minerals, and regulating fluid levels, all without asking for a moment of recognition. They're about the size of a fist, sitting just below the rib cage on either side of the spine, and most people go their entire lives without giving them a second thought. That's not necessarily a bad thing. It's actually a sign of how well these organs are designed to work quietly in the background. But when that filtering process starts to break down, the effects don't always show up where you'd expect them to. Instead of pain in the area where the kidneys sit, the body tends to show its distress somewhere else entirely. In the skin, in the legs, in the ability to concentrate, in ways that rarely point a finger back to the kidneys themselves. Some of what we're about to cover might surprise you, including one sign near the end of this list that many people mistake for something completely unrelated. Something most doctors say patients almost never connect to their kidneys until it's pointed out to them directly. It involves a part of the body you wouldn't expect, and once you hear the explanation, you may find yourself thinking back to moments in your own life where you brushed it off without a second thought. So if you've made it this far, stick with us, because that one alone might change how you think about a symptom you've been living with for years without ever asking why. Let's start with the most commonly recognized sign, because even though it's familiar, most people misunderstand what it actually means. Number 1, changes in urination. When kidney function declines, urination is often the first place changes appear, simply because the kidneys are the organs directly responsible for producing urine in the first place. This might show up as needing to urinate more frequently, particularly at night, or as urine that appears foamy, unusually dark, or tinged with a pink or reddish hue that could point to the presence of blood. The foaminess in particular tends to catch people off guard, since it can look almost like the surface of a freshly poured soda, and it often points to protein leaking into the urine rather than staying in the bloodstream where it belongs. Some people notice the opposite pattern instead, producing less urine than usual despite drinking the same amount of fluids they always have, which can feel confusing since it seems to contradict what most of us assume kidney trouble would look like. None of these changes on their own confirm kidney disease, since dehydration, infections, certain foods, and even everyday medications like ibuprofen can produce similar effects. A single foamy trip to the bathroom after a particularly dehydrated day at work isn't necessarily cause for concern. Still, when these patterns become consistent rather than occasional, showing up week after week rather than once in a while, it may be worth mentioning to a healthcare provider, since urine is essentially a direct window into how well the kidneys are doing their job, and it's one of the easiest things for a doctor to check with a simple test. Consider someone like Robert, a 68-year-old retired postal worker, who noticed he was waking up 3 or 4 times a night to use the bathroom, something that hadn't been part of his routine even 5 years earlier. He assumed it was simply age catching up with him, a natural part of getting older that everyone eventually deals with. It wasn't until a routine checkup, prompted by his daughter's insistence, that blood work revealed his kidney function had quietly declined over several years. His story is a common one, not because the sign itself is rare, but because it's so easy to explain away. Number 2, persistent fatigue and weakness. Healthy kidneys produce a hormone called erythropoietin, which signals the body to create red blood cells. When kidney function drops, erythropoietin production can drop along with it, which may lead to a condition called anemia, essentially a shortage of healthy red blood cells needed to carry oxygen throughout the body. The result is a specific kind of tiredness that doesn't resolve with a good night's sleep or a cup of coffee. It can feel like moving through the day with a weight attached to every task, an exhaustion that seems disconnected from how much rest a person is actually getting. Some people describe it less as feeling sleepy and more as feeling drained, as though the usual burst of energy that gets them through an afternoon simply never shows up anymore. There's also a buildup effect worth mentioning here. As waste products accumulate in the blood due to reduced filtering, that buildup itself can contribute to a general sense of sluggishness, layering on top of whatever fatigue anemia is already causing. Because fatigue is such a common complaint with dozens of possible causes, from thyroid issues to poor sleep to simple overwork, it's rarely the first thing that comes to mind when people think about kidney health. That disconnect is part of why this particular sign tends to go unaddressed for so long, often written off as just another symptom of a busy or stressful season of life, rather than something worth investigating further. Number 3. Swelling in the legs, ankles, or around the eyes. One of the kidney's core responsibilities is managing the balance of sodium and fluid in the body. When that balance is disrupted, fluid can begin to accumulate in tissues, a condition known as edema. This often shows up first in the lower legs and ankles, especially by the end of the day, sometimes leaving a visible indentation if you press a finger against the skin, and it takes a moment to bounce back. It may also appear as puffiness around the eyes shortly after waking, or as socks and shoes that suddenly feel tighter than they used to, even though nothing about the person's weight or routine has changed. It's the kind of change that's easy to blame on a long day standing, too much salt at dinner, or simply not sleeping well, and in plenty of cases, those explanations are perfectly accurate. But when swelling becomes a near-daily pattern rather than an occasional inconvenience, showing up regardless of activity level or diet, it may point to something the body is struggling to regulate internally rather than something purely external. This is one of those signs that tends to build slowly, a little more noticeable each week, which makes it especially easy to normalize over time until it's simply accepted as the new normal rather than questioned. Number 4. Persistent itchy or dry skin. This sign surprises a lot of people, and it's actually one of the more telling ones on this list. Healthy kidneys help remove waste products and excess minerals from the bloodstream. When that filtering process becomes less efficient, those substances can build up in the blood, and this buildup may contribute to skin that feels persistently itchy, dry, or irritated in a way that lotion and moisturizer don't seem to fix. It's not the occasional dry patch after a long shower. It's a more constant, sometimes maddening itch that can affect sleep and daily comfort. Many people spend months trying different soaps, fabrics, and skincare routines before ever considering that the root cause might be internal rather than something touching their skin at all. Take Harold, a 70-year-old retired mechanic, who spent nearly 2 years trying to figure out why his skin had become so persistently itchy, especially across his back and forearms. He tried switching laundry detergents, cutting out hot showers, and even a handful of over-the-counter creams his pharmacist recommended, none of which brought lasting relief. It wasn't until a routine physical, where his doctor happened to ask about any other changes he'd noticed, that the conversation turned toward his kidneys. Blood work confirmed reduced kidney function, and once treatment began addressing the underlying cause rather than just the skin itself, the itching gradually improved. Harold later said he wished someone had asked the question sooner, since he'd assumed the itching was simply a side effect of getting older. Number 5. Muscle cramps, especially at night. Kidneys play a central role in maintaining the right balance of electrolytes, including calcium, phosphorus, sodium, and potassium, all of which are essential for normal muscle function. When kidney function declines, this balance can shift, and one common result may be muscle cramps, particularly in the legs, that tend to strike at night and disrupt sleep. Anyone who has experienced a sudden, sharp calf cramp, waking them out of a deep sleep knows how disruptive this can be. While occasional cramps are common and usually harmless, especially after intense exercise or dehydration, cramps that become frequent and unexplained may be worth discussing with a doctor, particularly when paired with any of the other signs on this list. Take the example of Linda, a 72-year-old former schoolteacher who had dealt with nighttime leg cramps for nearly a year before mentioning it during a routine visit. She had chalked it up to simply getting older, something she'd heard other women her age complain about too. Her doctor ran a basic metabolic panel almost as a precaution, and the results showed her kidney function was lower than expected for her age. Linda's cramps weren't dramatic or constant. They were just persistent enough to eventually raise a flag once someone finally asked the right questions. We're just past the halfway point now, and the signs ahead tend to be even less obvious than the ones we've already covered, largely because they don't feel physical in the way cramps or swelling do. A couple of them affect how you think and feel day to day, which is part of why they're so often missed entirely, chalked up to a busy schedule, a stressful season, or simply getting older. And remember, we still haven't reached that one sign we mentioned at the very start, the one tied to a part of the body most people would never think to connect with their kidneys at all. Number 6, difficulty concentrating or mental fog. When waste products accumulate in the blood due to reduced kidney function, they can affect the brain as well as the body, sometimes contributing to a sense of mental fog, difficulty concentrating, or trouble with memory that feels different from ordinary forgetfulness. People sometimes describe it as losing their train of thought mid-sentence, or needing to reread the same paragraph in a book several times before it actually sinks in. This can be especially confusing for older adults, since mild memory lapses are often assumed to be a normal part of aging or an early sign of cognitive decline unrelated to kidney health, which makes it easy to dismiss without ever considering an alternative explanation. Reduced kidney function can also affect sleep quality in ways that aren't always obvious, including a condition called restless leg syndrome, which some people experience as an uncomfortable urge to move their legs right as they're trying to fall asleep. Poor sleep on its own can compound feelings of mental fogginess, creating a cycle that's difficult to untangle without medical evaluation, since it becomes hard to tell whether the fog is caused by the kidneys directly, by poor sleep, or by some combination of both. This sign rarely gets connected to kidney health, and that's precisely what makes it worth including here, since it's often filed away under stress or simply having too much on one's plate. Number 7, loss of appetite and unexplained nausea. As waste products build up in the bloodstream, they can affect the digestive system as well, sometimes leading to a reduced appetite, a lingering feeling of nausea, or even an unpleasant metallic taste in the mouth that doesn't go away no matter what a person eats or drinks. Some people also notice that foods they've always enjoyed, particularly meat, suddenly taste different or unappealing, which can be an especially strange and disorienting change for someone who's never had food aversions before. This might mean skipping meals that once sounded appealing, or feeling full after eating only a small portion of food, long before the plate is actually empty. Over time, this can contribute to unintentional weight loss, which is often mistakenly seen as a positive change rather than a signal worth paying attention to, especially among older adults who might otherwise welcome a slimmer figure without asking why it's happening. Because appetite naturally fluctuates with stress, illness, medication changes, and countless other factors, this sign is one of the easiest to dismiss, especially when it develops gradually rather than all at once, over the course of weeks or months rather than days. Number 8, shortness of breath. This is the sign we mentioned earlier, the one most people never think to connect to their kidneys. When kidney function declines, two separate things may happen that both affect breathing. First, fluid can build up in the lungs as part of the same fluid retention process that causes swelling elsewhere in the body, sometimes described by patients as a heaviness in the chest or a feeling that a full breath takes more effort than it used to. Second, the anemia that often accompanies reduced kidney function means less oxygen is being carried through the bloodstream, which can leave a person feeling winded during activities that never used to bother them, like climbing a flight of stairs or carrying groceries in from the car. Because shortness of breath is far more commonly associated with heart or lung conditions, and rightly so, since those are more frequent causes, it's rarely the first place people look when kidney health is the actual root of the problem. That disconnect is exactly why it often goes unrecognized as a possible kidney-related symptom until other signs make the connection clearer, or until a doctor orders blood work for an unrelated reason and finds the answer almost by accident. This is precisely the kind of overlap that makes kidney disease so difficult to catch early, since so many of its signs quietly borrow the appearance of other, more commonly discussed conditions. There's a reason doctors pay close attention when a patient reports several of these signs together rather than just one in isolation. And that brings us to a pattern worth understanding before we finish the list. Number 9, high blood pressure that's difficult to control. The relationship between kidney health and blood pressure runs in both directions, and understanding that relationship helps explain why this particular sign carries so much weight with doctors. Kidneys help regulate blood pressure by managing fluid balance and producing hormones that affect how blood vessels constrict and relax. But when kidney function declines, that regulation can become less effective, which may contribute to blood pressure that's harder to control even with medication that used to work perfectly well. Someone who has managed their blood pressure successfully for years with the same prescription might suddenly find their numbers creeping up despite taking their medication exactly as directed, which can be a confusing and frustrating experience. At the same time, long-term high blood pressure is itself one of the leading contributors to kidney damage over time, creating a cycle where each condition can make the other more difficult to manage, almost like two problems feeding off each other rather than existing independently. This is part of why healthcare providers often monitor kidney function closely in patients with a history of high blood pressure, checking blood work at regular intervals even when nothing seems obviously wrong. Unexplained changes in blood pressure control are sometimes one of the earlier clues that something else may be going on beneath the surface, which is exactly why this sign deserves more attention than it typically gets. Number 10, puffiness or swelling specifically around the eyes in the morning. While we touched on general swelling earlier, morning puffiness around the eyes deserves its own mention because it tends to appear earlier than swelling elsewhere in the body and is frequently mistaken for poor sleep, allergies, or simply getting older. It's often the very first physical sign anyone notices, sometimes months before swelling ever shows up in the legs or ankles, precisely because the skin around the eyes is so thin and sensitive to even small shifts in fluid balance. This particular pattern occurs because the kidneys, when not filtering properly, may allow protein to leak into the urine instead of keeping it in the bloodstream where it belongs, a condition often referred to as proteinuria. Reduced protein in the blood can lead to fluid shifting into surrounding tissue rather than staying where it should, and the delicate skin around the eyes tends to show this shift before other, less sensitive areas of the body do. If this kind of puffiness shows up consistently, rather than after an unusually salty meal, a glass of wine the night before, or a rough night of sleep, it may be one of the earliest visible clues that something deserves a closer look. And it's often something a doctor can confirm with nothing more than a simple urine test. Consider Margaret, a 65-year-old grandmother who noticed her under-eye puffiness in photos taken over several months at family gatherings. She initially assumed it was simply a sign of getting older, the same way she'd noticed other small changes in her appearance over the years. A relative who worked in healthcare gently suggested she get her kidney function checked, mostly out of caution rather than alarm. The blood work came back showing early signs of reduced kidney function, caught early enough that her doctor was able to work with her on a plan going forward. Margaret's case is a reminder that these signs are often small enough to explain away, right up until someone finally asks the question directly. Taken together, these 10 signs share a common thread. Individually, almost every one of them could be explained by something else entirely, which is exactly why kidney disease is so often called a silent condition. It rarely announces itself clearly, and it rarely shows up as just one dramatic symptom. Instead, it tends to whisper through a collection of small, easily dismissed changes that only make sense once you know what to look for, and often only in hindsight, once a diagnosis gives someone a reason to look back and connect the dots. One of the most striking facts worth remembering is that according to public health estimates, as many as 9 in 10 adults with reduced kidney function may not even know they have it, largely because the early stages so rarely come with obvious warning signs. That statistic alone is worth sitting with for a moment, because it means the people most likely to catch this early are the ones paying attention to the subtle stuff, not waiting for something dramatic to happen before they say something to their doctor. It's also worth remembering that certain groups face a higher likelihood of developing kidney issues over time, including people living with diabetes, high blood pressure, or a family history of kidney disease. If any of those apply to you or someone you love, these 10 signs may be especially worth keeping in mind, not as a source of worry, but as a checklist that could prompt an earlier conversation than might otherwise happen. None of this is about assuming the worst every time your legs feel a little swollen or you skip a meal. It's about noticing patterns, paying attention when something feels different for more than a few days, and trusting that instinct enough to ask a professional rather than dismissing it entirely. If any of these signs sounded familiar while watching this, it doesn't necessarily mean anything is wrong, but it may be worth a conversation with your doctor and a simple blood or urine test to check how your kidneys are doing. These tests are quick, widely available, and often covered as part of routine blood work you may already be getting during an annual physical. Early awareness tends to make a meaningful difference in how these situations are managed going forward. And in many cases, catching changes early gives doctors far more options for slowing or managing the condition than waiting until symptoms become impossible to ignore. We'd love to hear from you in the comments. Did any of these signs surprise you, or have you noticed one of them in yourself or someone you care about? If this video helped clear something up or gave you something worth remembering, consider sharing it with someone who might need to hear it. And if you'd like to see more videos like this one, subscribing helps us know to keep making them. Thanks so much for watching, and take care of yourself.